All right, so we got Joe here. We're gonna do a low back assessment. Number one thing that I wanna know is just a little bit of history from Joe. So we've been treating Joe here for a little while, and so we kind of have a little bit of a backstory as far as, he's a lifter, very physically active, coming in with low back pain. And so these are some of the assessments that I'll use in the office, right? So first thing that I like to take my patients through is through range of motion. And so the very first thing I'm just gonna have Joe do is going into flexion. So I'm just gonna have him go all the way down as far as he can to touch his toes if he can. Now, if there's pain within here, depending on what kind of pain it is, that'll tell us some different things. If he has any sort of shooting pains down his legs, we might be thinking disc. If it's just tightness and tension, okay, maybe there's a little restriction within the soft tissues of the joint itself. Okay, go ahead and stand up for me, Joe. Perfect. The next thing that I like to take my patients through is a little bit of extension. So just go ahead and lean backwards for me. And again, we're looking for any sort of pain, tightness, anything like that. If we have shooting pains, might tell us a little bit of a nerve impingement in there. Otherwise, just having my patients describe the pains as we go through this. The next thing would be rotation, just hands on the hips and rotating side to side. Perfect. And then hands on your sides and going side to side into lateral flexion. Very good. So this kind of gives me a baseline as far as whether or not there's pain with any of these ranges of motion, whether or not there's restrictions within these motions as well. Then we'll move on to our orthopedic exam. So I'm gonna have you lay on your back for me first, Joe. Now, within the history, say we do have some sort of traveling or shooting pains down the leg, my first thing thinks, okay, maybe we have some sort of disc injury here. So the first test that I'm going to do with Joe is to kind of confirm whether or not we have any sort of disc issue within his low back. So let's say he has a bunch of pain traveling down his right leg. I'm going to start on the non-affected side first, or the side where we don't have as much pain. And we're just going to do something called a straight leg test, where I'm just going to bring his leg up. Okay. And Joe's got good flexibility, and in a normal patient, there wouldn't be any pain in through that side, right? Then going over to the affected side in the patient, if they did have some sort of acute disc injury, okay, you might start seeing pain in patients as little as right in through here, right? But especially if we get into that 45-degree range and we start feeling some pain in there, my mind just shoots right to some sort of disc injury there. Okay, we also like to take a look at the hips, and again, most of these tests I'd be doing on the unaffected side first and then moving on to the more affected side. But checking out range of motion within the hips, going into full flexion, okay, checking out some internal rotation, seeing if there's any restriction within the hips itself, and then dropping them into more of a extended position in external rotation there as well, okay? As long as all that checks out, then we'll move on to the next portion of our exam, having him flip over onto his stomach here. All right, so, and what I like to do in this position is just kind of get a sense of whether or not there's any sort of muscle spasming or any restriction within the joint itself. So me being a chiropractor, I like to use my hands and just kind of palpate, feel through the spine and any sort of restriction through there. So we're checking his SI joint, seeing if there's any restriction through there, checking out through the lumbar spine and through here. A lot of times if there is a disc injury, okay, we're feeling it right in through here above the pelvis. And again, if I put some pressure in there, sometimes we do get that shooting pain in through his leg, right? But in a normal low back patient, a lot of times we get that SI restriction. So where the sacrum and the ilium come together, known as your SI joint, sometimes that doesn't move properly. And sometimes the actual muscles that attach to that joint, there's some restriction or some tightness within there as well. So a few other tests that I'll do, I'll bring the heel up towards the glute, just kind of see if there's any pain or restriction within there. We have a little restriction in Joe on here. And then heel towards the opposite glute here, same thing, looking for pain or restriction. Out this way, checking out that hip here, And then wouldn't necessarily do this in a patient who I suspect a disc issue with, but normal low back, we're checking that kind of extension of the hip in through there as well, all right? Once we kind of make sure that there's no other red flag symptoms, again, some different things that we'll go through within the history with our patients, and I deem that it's safe to adjust the patient, then we'll go ahead and we'll get the muscles and the joints moving properly, okay? Here within this office, I love to incorporate both muscle work as well as the adjustment. And so there are a bunch of different therapies that I'll utilize, including myofascial release technique, Graston therapy, dry needling therapy, as well as our class 4 laser that we have here in the office. But today I'm just going to show you how I adjust a low back just for a normal low back patient that has maybe a little bit of restriction in through that area. And then I'll also show you a couple different techniques that I utilize. So the first one that I'm going to show you is just a what's known as a drop table adjustment here. And I use this a lot of the times just within the pelvis, just to kind of get everything nice and loosened up here. So I'm going to prop this drop table up here. And let's say I felt some restriction within that left SI joint within Joe on this side. We'll just make our contact right in through here, put a little pressure in here, and just give it a little drop, okay? A lot of times, that might be all that it needed, was just a little bit of a push, and be totally fine, okay? Another one that I like to utilize just to kind of help gap out the joints within the hip and the low back here is what's known as a long axis distraction, okay? And we'll use this a lot of the times. It's not a very specific adjustment, but it is something that can help create some space within the hip and the low back itself. So what I'll do here, let's say we had that left side, left SI and hip dysfunction on this side. We bring this off to the side, give it a little traction in through here, and then just give it a little pull, just like so, all right? Awesome. And then the classic one that if you are, if you know of chiropractic or if you've been to a chiropractor before, is a side posture adjustment. We'll do that one next. I'm gonna have Joe go ahead and lay on his side facing me this way. And then just head right on the headpiece there, okay? Bottom leg's gonna stay straight, top leg's gonna come on up, just like so. We're gonna bring this on over here, okay? And what I'm gonna do is just stabilize his upper back, and then we're gonna bring him into rotation here. Now again, this might not be one that I use in a patient who has a lot of acute disc issues or you know, any sort of severe low back pain on that day. We might go a little bit lighter and focus more so on muscle release and more passive therapies. But with this, with just a normal low back tightness and tension restriction within the joint, this is 100% safe to do. So we're just gonna go ahead and give him a little rotation here. Take a deep breath in for me and out. Relax your tummy down. Good. Perfect. There we go. Now, what I always like to do as well with my patients is give them some sort of exercise or something that they can focus in on at home, right? A lot of the times with low back patients, they tend to deal with a lot of flexion throughout their lives. So sitting at home, sitting at a desk, lifting up heavy objects throughout their day. And so what I like to teach my patients is how to move in the opposite direction to offload some of that pressure. Especially if we have any sort of disc bulge, anything like that going on, this is a good way of creating space within the lumbar spine and providing some relief. So I'm gonna have Joe go ahead and go onto his hands here. And there's different progressions within this exercise as well. Sometimes we just start with patients just on their elbows, just to create a little bit of extension in through here, create a little bit of space, and this can provide a lot of relief with my low back patients. For Joe, we already kind of know what's going on, so I'm gonna have him go through the full extension up onto his hands here, okay? And I'm gonna provide just a little bit of pressure myself as he presses up in there. Now I'm just kind of using my hand as a bit of a fulcrum for his low back to extend around there. And again, just providing a little bit of space, offloading some of that pressure in through that low back. Usually we'll go through about a set of 10 of that. I like to couple it with a little bit of Graston technique. And so if you want to go ahead and just go onto your knees and elbows for me. And we're going to lift up on his shirt here, and I'm just going to kind of show a few moments of what this would look like here. So we take our little stainless steel instrument here, we provide, or we put the patient into a position in which we're going to lengthen out the muscles here, put them on tension, and then we'll mobilize the tissue that we're working on through the instrument. All right, so we're just kind of gliding in through the area that might be restricted or tight, just providing a little bit of relief in through there, mobilizing that tissue, and then creating some blood flow in through that area. So blood flow carries oxygen and nutrients into the tissues and helps jumpstart the healing process, right? So that's a little bit of Graston for you. Again, we have a number of different therapies that we can utilize. This is just one of the tools in the toolbox, right? So I always like to send my patient home with some sort of exercise, some sort of stretch, because, you know, as I tell all my patients, I'm just a supplement, right? The stuff that they do at home is what's going to help provide the most long-term success and relief here. So that's a low back assessment, and let me know if you guys have any questions.